Welcome to today's episode. It is an Ask Me Anything episode where about a month or so ago, I went on Instagram and I asked my followers to send me their questions. And I'm going to be answering a lot of them today. And we're going to be covering things like facelifts, like how to tighten up skin without surgery. We'll talk about breast implant illness, facial treatments to recommend after the age of 40, NAD therapy, tips for crepey skin, and a whole lot more. Okay, so today is an Ask Me Anything episode. I think this is my 6th Ask Me Anything, and I'm going to take your questions. We're going to answer as many of these as I can, and I do venture a guess because we're going to be talking about a lot of different topics today that hopefully some of these you will find appeal directly to you, my friends. All right, so first question is how to correct loose skin and stretch marks around the belly button without a tummy tuck. So this is something I see all the time, and I get patients ask me all the time, Dr. Youn, how do I get rid of this little bit of extra skin hanging over my belly button? A lot of times, women will say, hey, I've had a belly button piercing here. Now after having a couple of kids, the skin there doesn't look that great. Can't you just kind of snip that skin off and just cut it out without having to do a full tummy tuck? Unfortunately, it's a lot harder than that. There's no great way to remove kind of that overhanging skin over a belly button without creating a very unnatural looking scar. And the scar typically is shaped kind of like a handlebar type of a mustache almost. Because you have to cut the skin out in what we call an ellipse. You can't just cut extra skin as like a circle or a square and then stitch it together and still have it look flat. You have to remove it in what we call an ellipse shape, which is kind of like the shape like of an almond or like an almond-shaped eye. Because you need to have those edges basically taper down so that you don't create what's called a dog ear or skin that kind of bunches up on the ends. And so unfortunately, the problem with that is you get this kind of scar afterwards that once again looks kind of like the shape of a mustache, and that doesn't look all that right on the front of an abdomen. And so I have never been able to figure out a good way to try to get rid of extra skin just over a belly button, let's say even from piercing or anything like that, without creating a scar that doesn't look right. And so unfortunately, in my opinion, there's no other way around this to try to remove skin and stretch marks around the belly button without technically doing some type of a tummy tuck. Now, tummy tucks come in all different types. There's a mini tummy tuck, which is good to remove skin, typically hanging over, let's say, a C-section scar. More of the full or traditional tummy tuck removes skin that's between the belly button and the pubic area. That will create a scar that extends hip to hip. And then there are other tummy tucks that are even more aggressive than that. Like there's a fleur-de-lis tummy tuck. There's a circumferential tummy tuck or a lower body lift. These are all bigger operations. I do believe that technology is improving nowadays. We are starting to see some reasonable, getting there, not quite there yet, non-invasive body tightening treatments. Probably right now the gold standard is Morpheus 8 for the body. But I'll tell you, in all honesty, I'm a big fan of Morpheus 8. We do a lot of that for the face and neck. At this moment, I don't have the body handpiece. And so I can't tell you that it really works that great, but that would be an option, is to do a handful of those types of treatments if you just have some loose skin around the belly button area, to see if that can improve it enough to make you happy. Because otherwise, unfortunately, the other option is to really look at doing an actual tummy tuck. All right, so next question is, how much does a facelift cost? So this is a very hot topic in plastic surgery right now. I am one of the only plastic surgeons that I know of where I actually put my prices of surgery and or injections on my website. So if you go to my website and you look at Youn Plastic Surgery under resources, you'll actually find the prices of all the operations that I do. And these are pretty accurate. Now, depending on your anatomy, the surgery may be a little bit more, a little bit less based off the time that it takes to perform the operation. But in general, this is a pretty good estimate of prices. Unfortunately, this is not true of the vast majority of plastic surgeons. And there are a couple of reasons for that. Number one, sometimes plastic surgeons want you to call their office to try to get those prices. That way they can get you on the phone and hopefully get you making that appointment, because you've already called them. Another reason why plastic surgeons don't put their prices online is because those prices sometimes change. And if they're not updating their website regularly, then that price may not be accurate, in which case they may find that, somebody says, hey, you know what, you told me, on the website, the price is, let's say $10,000, but now you're telling me it's $12,000. What gives? Because I want to pay the $10,000, and usually saying, oh, we forgot to update our website is not the, the best excuse for that. There are some plastic surgeons, and I really obviously frown on this practice, where they will charge patients, believe it or not, based off of how much money they think they have. And I have seen that in one practice in the past, where they kind of, you have, let's say, a patient manager, patient coordinator or manager that meets with the patient before even the doctor does sometimes. They get an idea of kind of what the financial status of this patient is, and then they alter their fees based off of how much money they think this patient has, which is crazy, which is, I think, is unethical, And so they say, oh, well, this person, I think, is going to struggle to pay for this. Let's charge them a bit less. Or they may say, oh, this person's a owner of this massive business. They must be a millionaire. Let's charge them more. I don't do that. I charge the same for every patient, no matter what. We do give discounts to military personnel, firefighters, first responders, physicians, that type of thing. So the question is, how much does a facelift cost? And the answer is, it depends on who you go to. So my cost is on my website, dryoun.com. Take a peek at that. I honestly don't know exactly what it is. I can't tell you off the top of my head, but it is on that website. There are plastic surgeons now who are charging insane amounts for facelifts, $150,000, $200,000 for facelifts. And I think that is not right. I don't think it's right, because your technique is not that good that it should be costing that much. But at the same time, I also am a capitalist. Like, I do believe that you should be able to charge whatever you want. And if patients pay for it, then that's your decision. Or if patients decide it's too expensive for them, that's your decision. If you charge so much that nobody pays for your services and you go out of business, then that's your decision. But it really does vary. In general, I think you can get a good facelift from a solid plastic surgeon for less than $40,000, which is still a ton of money. But when you're talking about some doctors who don't have national profiles, who haven't published a lot and stuff, and they're charging $50,000, $75,000, $100,000 for facelifts, it's just, wow, it's out there. So that's my answer to how much does a facelift cost. Okay, the next question, and I just mentioned this treatment, is Morpheus 8 best for skin tightening, and how about BodyTite? So these are two very different treatments from the same company, InMode, and I'm a big fan of the InMode products. I've been using InMode devices for a long, long time. Morpheus 8 is radiofrequency microneedling, and the way to describe it is it's, microneedling basically is taking tiny needles and puncturing the skin. The original microneedling is dermal rollers, and you may remember seeing, people still use them. They look like little rolling pins with tiny little pins on them, and you roll them on your skin, and it creates tiny little micro traumas to the skin. By creating these micro traumas to the skin, you damage the skin in a controlled fashion, and that causes the collagen as it heals to heal in a tighter fashion. And so dermal rollers do that. We do it in the office with automated microneedling, where we have hand pieces that go certain different tunable depths, or we can cause it to go, let's say, 1 millimeter in the skin or 2 millimeters or anywhere in between. That creates trauma to that skin, once again, in a controlled fashion. When that trauma is limited, it can cause that collagen as it heals to heal once again in a tighter fashion, and that can basically rejuvenate the skin. Radiofrequency microneedling is taking that microneedling to the next level, where you combine the needle going into the skin to create that micro trauma, that puncture in the skin, but that needle is insulated up until the tip, and the tip emits radiofrequency energy or heat, and that heat then heats up the deeper skin. So now you kind of get a twofer. You get the needle going in the skin, creating the micro trauma, and you get the heating of the deep skin. Both of those, once again, will cause that collagen to tighten. And that's the main benefit of Morpheus 8, is you get some skin rejuvenation, some very, very mild tightening out of it in a treatment that is essentially non-invasive. We do it in my office almost every day. We do Morpheus 8. We probably do, honestly, every day, at least one Morpheus 8 treatment. And these treatments have very minimal downtime. You may get redness for a day or two. We've been using topical exosomes to help reduce the redness, so that redness goes away very quickly. It's the one that we use is called plated. And then the other thing you have to keep in mind that a lot of people have talked about with Morpheus 8 is fat reduction. And there is some truth to it, is that if you do an over aggressive deep heating of the skin, it can potentially disrupt and even kill some of the fat cells below that. And there have been a lot of stories of people who've had aggressive radiofrequency microneedling treatments and have actually lost fat from it. We do RF microneedling, Morpheus 8, like I said, every day in my clinic. Knock on wood, I've never actually had a patient come back and say they developed fat loss, but I think part of it is that we also limit the settings. We don't go super deep with it. We don't turn the energy all the way up. And I do think that may make a difference there. So the question is Morpheus 8 best for skin tightening? For non-invasive skin tightening today, I believe Morpheus 8 is the gold standard. But once again, you want to make sure that whoever is doing it for you is not being over aggressive because the worry of, once again, fat loss underneath. Then the question is what about BodyTite? BodyTite, also from InMode. I don't do this treatment, but I know a lot about it. Essentially what it is you've got radio frequency energy on a paddle that is on the surface of the skin, and then you have a probe that goes underneath the surface of the skin that emits radio frequency energy too. And the idea, it's kind of like you have a sandwich where the skin is like the burger or the meat in a sandwich, or the cheese if you're vegetarian, and then the bread on top is the paddle emitting radio frequency energy going to the skin from the outside, and you've got this radio frequency emitting probe underneath the skin that is causing heat from the inside as well. So you're heating the skin from the inside and the outside. Now, this is an invasive treatment, albeit minimally invasive, kind of like liposuction. You have to numb the area up with an injectable anesthetic, otherwise it's way too painful. And then what you're doing essentially is you're taking that probe and you're heating the skin from, once again, the inside and the outside. I'm not a huge fan of this type of a treatment unless you 100% know you're not going to get a lifting surgery. Because this treatment, it is surgical, it will create scar tissue underneath. And the amount of tightening that you get is not going to be dramatic, okay? It's going to be more than, let's say, Morpheus 8, where it's just a outside type of a treatment. But anytime you're sticking something underneath the skin, you're creating significant heat, you are going to create scar tissue there. And if, let's say, afterwards, 5 years later, 2 years later, 10 years later, you want to do a lifting surgery, like let's say a facelift, then you may have a little more difficulty with that operation due to the scar tissue that has been created by this type of a treatment. So this is BodyTite, the other one that's real popular. So they have BodyTite, which does this kind of sandwichy treatment on the body. There's also FaceTite, which does it on the face and the neck. And then the other treatment that's kind of similar to that I believe is similar, is Renuvion, where that uses plasma energy to heat the skin from the inside as well. These treatments create scar tissue. I do think they can be mildly effective. If you're never going to have surgery and you've got a little bit of extra skin on your tummy or in your neck and you want to do something like that, then by all means, that's an option for you. But if you are considering, let's say, doing a tummy tuck in the future, or you're considering doing a facelift, then this is not a treatment I would generally recommend. Okay, so kind of on the same vein, a question about non-invasive treatments for sagging and crepey neck skin. So really, that's what I would consider. So if you say, hey, look, I've got a little bit of saggy and crepey skin in my neck, what's a non-invasive treatment for that? Morpheus 8 is a great non-invasive treatment for that. And if it does lose a little bit of fat, usually that people don't mind that in the neck area. They just don't want it in the cheeks. And so if you're looking at non-invasive skin tightening for the neck area, then Morpheus 8, I think, is a really good one. You can also do fractional laser treatments to those areas. That can also help with stimulating collagen production and smoothing the surface of the skin. That's going to be the best non-invasive option. If you want to go minimally invasive, then you are looking at FaceTite and Renuvion that I had just mentioned. Okay, so the next question, are workouts to avoid after breast augmentation long term? So when we put breast implants, we can put them either above the muscle of the chest, we call it a subglandular approach or a subfascial approach, or we can put it underneath the muscle of the chest, which is subpectoral, or what we call a dual plane. A dual plane is where the top part of the implant is under the muscle, but the bottom part is not under the muscle. And typically in my patients, the vast majority of them, I do a dual plane technique, which is basically partially under the muscle. Now, if you have implants above the muscle, then it is not impacted by the underlying muscles at all. And you should be able to do any type of exercise that you want. If they're above the muscle, subglandular or subfascial, okay? In general, and you may ask, then how, Dr. Youn, how do I know if my implants are above or under the muscle? And the answer is pretty simple. If you take your hands and you put them on your waist and you press towards your belly button and you flex those chest muscles, if your implants barely move at all when you do that, then you're probably above the muscle. If you are doing a push-up, if you're doing a bench press, if you're doing flies and your implants don't seem to move with the flexion of that pectoralis muscle, then most likely it's above the muscle or subglandular. If, however, when you put your hands on your hips and you press towards your belly button, those implants shift and they move kind of outward or downward, especially if they do it a lot, then you know that you're most likely under the muscle. So essentially, if you flex your muscles, the pectoralis muscles, and the implants move and stuff with it, then oftentimes that's a good sign that you're below the muscle. So if you are above the muscle, then you can do any exercise that you want. You should not be limited because that implant will not be affected by that. But if you are below the muscle, then I don't recommend long-term doing a lot of exercises that build up that pectoralis muscle, the muscle that the implant's underneath. And the reason why is not something that you're gonna get a bad complication or it's gonna pop your implant or anything like that. It's just that if that muscle gets really, really strong and really thick and you got an implant underneath it, it can gradually push the implants outward. Okay, you can get what we call lateral migration, where those implants gradually move outward as the years go by, and the separation between those implants becomes wider and wider. If you've been following me, you know that I'm all about promoting holistic health and lifestyle. But that sounds expensive, right? Well, the truth is, some of the simplest changes you can make are actually the cheapest. Maybe you've already ditched your synthetic air fresheners, your plastic containers, and your nonstick pans. But here's a health issue that most people don't think about: your cleaning products. Do you ever get a headache after scrubbing the bathroom? That's not just a strong scent, it's a red flag. Because even those products that look clean or claim to be natural often contain ingredients linked to hormone disruption, skin irritation, and respiratory issues. That's why 3 brilliant women created Branch Basics, a human-safe plant and mineral-based cleaning concentrate that works on just about everything. It's powerful and way more affordable than what you'll find at your local grocery store. When you purchase the starter kit, you get 1 big bottle of concentrate that makes 13 bottles of cleaner. That breaks down to just $3.25 per bottle. Plus, you can use it for everything: bathrooms, kitchen, laundry, floors, windows, even washing your produce and your makeup brushes. If you're looking for one easy, affordable swap to improve your health and your home, this is it. Head to branchbasics.com and use the code Dr. Youn for 15% off your starter kit. Again, that's Dr. Youn for 15% off your first order of a starter kit. Branch Basics is a must for anyone looking to make the swap to human-safe cleaners. I love Branch Basics, and I bet you will too. And most people aren't really happy with that. So usually what I recommend for my patients who have implants that are under the muscle is to limit the amount of chest exercises that they do. Definitely, if you want to do some, go ahead and do it. Stay toned, stay healthy, stay strong. But I don't recommend doing chest day at the gym and say, hey, you know what, I'm going to do three sets of bench presses. I'm going to do 3 sets of flies, and stuff like that. Now you are really building those muscles up, which is not going to be beneficial in general cosmetically for the implants. That's also a reason why if I get a patient, let's say, who's a big-time bodybuilder and they want implants, I will typically put them above the muscle, not below, so that they can do whatever exercises that they want and not feel it's going to impact their implants. And so that also when they're flexing and they're posing, that their implants aren't looking kind of weird and moving around and stuff. Okay, another breast question: is breast implant something you just developed by chance, or can you avoid it? And the answer is, we don't know. Okay, there are plastic surgeons who don't even believe breast implant illness is real. We are trying to get to the bottom of why some women seem to get sick from their implants. There have been a lot of hypotheses thrown out there, and none of them have been definitively proven, and some of them have been basically disproven. So one of the hypotheses with breast implants is that it is the heavy metals that are present in breast implants in very tiny amounts that are causing people to get sick from them. There have been studies that have actually biopsied the capsule or the scar tissue surrounding implants looking for heavy metals and seeing is there a higher number of heavy metals in that capsule, that scar tissue surrounding the implants, versus somebody who doesn't have implants. Or if, let's say, somebody has breast implant illness, do they have a higher rate of these heavy metals in their capsules versus somebody who doesn't have breast implant illness but has implants. And all of these have come back as a big negative. There does not appear to be any evidence that heavy metals have anything to do with breast implant illness or an increase in heavy metals in at least the tissue around the implants. Another question that people had is it silicone that migrates from the implant into the tissues that is causing breast implant illness? And the interesting thing is that when you look at breast implant illness, there's a belief that, well, maybe it's the silicone gel on the inside of an implant that can cause breast implant illness. But that's unlikely to be the case because patients who have saline implants also have breast implant illness. So it's not just people with silicone implants, it's also people with saline implants. And they've done studies now too where they have biopsied the capsule, once again, that scar tissue shell around the implant, and have found microscopic silicone particles in it in people who have silicone gel implants, but they don't find them in patients who have saline implants. Yet they have patients who have breast implant illness in both groups. So it doesn't appear to be necessarily due to just silicone from the inside causing this. So we don't really know what's causing breast implant illness. And so we don't know if you're at higher risk. There are some small studies showing that if you have a history of autoimmune disease, if you have severe allergies or irritable bowel syndrome, that you might be at higher risk of breast implant illness. But these are small studies. We don't know exactly why these can be potentially possible. So really what it comes down to is that if you're thinking about breast implants, you have to keep in mind that your implants might make you sick. It's unlikely. I believe it doesn't happen to the vast majority of patients, but there are a small percentage of patients who do appear to get sick from their implants. I think it's real, and I don't have any idea why it happens, nor does anybody really. We just don't know. But there is a small percentage of people who do get sick from their implants. The good news with that is it does appear that the vast majority of those patients get better if their implants are removed. And so those studies are pretty solid that if you do appear to have breast implant illness and your implants are taken out, that most people get better. The vast majority of patients get better. But there's no way to determine beforehand if you're going to get it. And that's the risk that you take if you have breast implants put in. And I tell this to all of my patients. So if you listening right now, my friend, in our Rejuvenation Nation, are thinking about breast implants and you've been hemming and hawing, like, I don't know if I should do it. I'm worried about breast implant illness. My recommendation for you is only get breast implants if you know 100% that that's the right thing for you. Everything that we do has risks and benefits. And those benefits have to truly outweigh those risks significantly for it to be worth it for you to change your body in this manner via surgery with the potential risk of complications. And if you're at all on the fence, you're like, I don't know, should I do it, should I not? The answer is don't do it. You never regret surgery you don't do. You only regret the operations that you've done that you never should have done in the first place. And so always try to remember that. Another thing, this is kind of a saying in my own life, if it's not a hell yes, it's a no. And so with surgery, it's the same way. If it's not a hell yes and you're gung-ho, I'm going to do this, then it probably should be a no. Okay. What facial treatment would you recommend after the age of 40? That's a great question. And there's a lot of great answers to that. So number one, you want to look at skincare and getting on a good skincare routine. If you don't have a good skincare routine right now, I encourage you to look at the 2 minutes, 5 years younger skincare routine. This is 4 products, a couple, 2 steps, 3 steps in the morning, 2 steps at night, and then an exfoliation step a couple of times a week. 4 products. You go to younbeauty.com. We've got the 2 minutes, 5 years younger skincare routine. We tested it on people and found that after 2 months, our patients and the people who did it looked upwards of 5 years younger. And it literally takes just 2 minutes a day. So if you're looking at skincare and you want something to consider, you're not on a routine, then try the 2 minutes, 5 years younger skincare routine. I think you'll like it, and I think it really works. And it's a very basic 2-minute routine that everybody can definitely do. But as far as facial treatments that I would recommend, there are a lot of treatments out there, and these should be targeted to your specific issue. And so if your issue is age spots and dark spots, then the treatment I would recommend would be IPL, Intense Pulse Light. It is amazing for dark spots, no downtime. It's not that expensive. and really helps a lot of people. If, however, you just are looking at overall skin quality, you've got maybe some fine lines and wrinkles, you've got some roughness to the texture of your skin, you're looking just to kind of overall rejuvenate it. And let's say you're on a really strict budget, then microneedling may be a good option for you because microneedling is not that expensive and it's a great way to just overall rejuvenate the skin in a mild fashion. If at the age of 40, let's say you're noticing loose skin, then Morpheus 8 would be a good option for you. I think that's great for people who are, let's say, 40 years old. They're starting to notice a little bit of skin looseness developing. They don't have jowls yet. Things aren't hanging yet, but they're starting to notice that things aren't quite as tight as they used to be. Then a treatment like Morpheus 8 is fantastic. We do that in my office all the time. If, let's say, you don't have access to a dermatologist or plastic surgeon or med spa and you want to do something at home, red light therapy is great. And there are a lot of great red light therapy masks out there that you can do at home as a way to get those treatments, but without necessarily spending thousands of dollars and without having to leave the comfort of your own home. And so these are some things that I would recommend if you're the age of 40 to consider. There's so much more to it. I have my book, Younger for Life, and that's kind of the guide to autojuvenation, using your body's own regenerative abilities to turn back the clock. Would encourage you to read that because that's going to give you all the options short of surgery. So if you don't want surgery, good, because it's not in the book. But if you're looking for food, if you're looking for supplements that I recommend, skincare I recommend, non-invasive treatments, and minimally invasive treatments, all of that is in my book, Younger for Life. And then we do have a bunch of free gifts too if you do end up getting it. So take a peek. It's on Amazon. It's on barnesandnoble.com. It's at certain stores. And we're going to have it actually releasing the paperback here very, very soon. So I would encourage you to take a peek at it. And there is an update in the paperback that I recently wrote about new things in cosmetic medicine as well. Okay, next question. Do we need supplemental collagen? Can it beat genetics in the case of skin health? So how much does genetics truly impact the health of your skin and really your whole health in general? Well, there's actually an 80-20 rule with genetics. And so there's this idea behind, there's a term called epigenetics. And if you haven't heard of it, let me explain what that means. Epigenetics basically is this idea that you have control. You don't have control over the genes that your parents give you, okay? And that constitutes 20% of your overall health and even how quickly you age. 20% of that is the genes that your parents give you. And sometimes those genes will cause premature aging. There are genes of people where they get early jowling, they get bags under their eyes, they get loose skin of their eyelids, and they've inherited that from their parents. And that's that 20%. The other 80% is epigenetics. And epigenetics basically means that your body, depending on how you live your life, will dictate how those genes then present themselves. And so the genes are written in the code of your DNA, but how you live your life will impact how those genes then impact yourself. And so you have control over that 80%. 80% is what you do in life, and then the other 20% you can't control. Your parents give it to you. So genetics can definitely be beaten. You can overcome genetics to a certain extent with that 80%. Now, the question here is, do you need supplemental collagen? Well, nobody needs to take collagen. I look at that as more of a desire. If you can get enough protein in your diet regularly, if you're, let's say, drinking bone broth, then you're going to get that collagen. You can get that in other ways. Am I a fan of supplementing collagen? 100%. I'm a huge fan of that. We have my own Youn Beauty supplemental collagen. It's our top selling product in all of younbeauty.com. So full disclosure, yes, I believe in it. But yes, I do sell it myself. But I also take it myself. I take it myself almost every single day because I know the benefits. I send it to my mom. I send my mom, she's on a subscription where every 2 months she gets 2 tubs sent to her, and she and my dad take it. I send it to my sister every month. I send it to my sister-in-law every month. So I do 100% believe in it. And there are a lot of studies that show that taking a daily hydrolyzed collagen supplement can improve the collagen of your hair, skin, your nails, even your bones. And all you have to do is look at the reviews and the testimonials of people on the website, on our younbeauty.com website, and you'll see all the testimonials of people saying what the collagen has done for them. It is crazy, but it's not immediate. It does take 2 to 3 months to really start noticing those benefits. Benefits on the skin, on the hair, thickening of the hair, on strengthening of the nails, Ever since I've been taking collagen, my nails are growing faster, honestly, than I want them to, but they do. I have to cut them more regularly than I used to. And it can even potentially help with bones and joints. In our supplemental collagen, we have not just type 1 collagen, which is hair, skin, nails, bones, but we also have type 2 and some type 3 collagen, which is in cartilage and even in the muscle. And so people are finding that taking this type of collagen can also help with muscle aches and joint aches and all of that. So I'm 100% a big believer. Just take a look at those testimonials and see what people say about it. Take a look at the studies. There are a lot of studies out there that are very positive about collagen. I am bullish on collagen, my friends, because I believe in it. I use it. I send it to people I love. And yeah, I'm a big believer. Okay, next question is NAD therapy. Is it safe? So what is NAD therapy? So NAD is basically a protein, or it's not a protein. It is a, it's a peptide, which is basically, it's a protein, but it's a peptide in the body that can, basically what it does is it extracts energy from the food that we eat. And so it is absolutely essential to energy production in the body. And we know that levels of NAD decline as we get older. And there is a belief that declining levels of NAD with age contributes to a decline in our energy as we get older. I noticed that in myself. I'm 52, and when I first moved to the Detroit area, and this was back in 2004, I had no money. My wife and I were $500,000 in debt from our medical school education and stuff. And so we moved from an apartment, or actually from a storage unit to an apartment. And then a couple years later, maybe a year and a half later, we moved from an apartment to an actual house once I got established. And so when we moved to the house, I did hire 2 guys to help me move at the time, which is the first time I'd ever had hired anybody to help me move. It was always my buddy, Tim Bozon, who would always help me move in the past. You know that they're a good friend of yours when they help you move. When they're helping you with your couches and all that stuff and moving, and all you have to do is buy them dinner or something and get them a drink or something to thank them for it, you know that that's a good lifelong friend. And so this is the first time I actually hired a couple of movers to help me with it. But I always felt guilty. I'm not the type of guy who, if I see somebody doing work that I could do myself, okay, that I would just sit there and watch TV while they move my stuff. No, I was with them moving the whole time they were, because part of it is that I would feel guilty. It's just not my thing. I don't, even if I'm paying you, then let me help you too, because I'm able-bodied as well. This holiday season, give the gift that truly matters: health. Branch Basics and I believe that creating a healthy home is one of the most important things you can do for yourself and the people that you love. Did you know that conventional cleaning products are filled with harmful chemicals that can negatively impact your family's health? Well, from toxic fragrances to harsh disinfectants, these products can irritate your skin, disrupt hormones, and even pollute the air inside your home. But here's the good news. Branch Basics is on a mission to educate families about these hidden dangers and provide a better, safer alternative. The Branch Basics Starter Kit is a powerful plant and mineral-based solution designed to clean every room in your home, and this is without harmful chemicals. With just one concentrate, you can use it for everything: kitchen counters, bathroom tile, laundry, even washing your produce and your makeup brushes. And because it's a refill system, each bottle comes out to just $2.13. Well, get yourself and your loved ones the best gift of all, the gift of clean with Branch Basics. For a limited time only, our listeners get 15% off and free shipping on their premium starter pack when you use the code Dr. Youn at branchbasics.com/Dr. Youn. That's 15% off your order at branchbasics.com/DRYOUN with the promo code DRYOUN, Dr. Youn. Please support our show and tell them we sent you. Get Branch Basics this holiday season because cleanliness matters. And so I remember when we moved into my house, and the first house I ever second house we ever had, and I literally was on my feet moving my stuff for, I think it was 12 hours that day. And I was exhausted at the end of the day. But now at the age of 52, this is 20 years later, maybe a little bit less than that, I spend 2 hours doing work outside and I am beat after that. And I feel like I don't have quite the energy that I used to, although I'm trying to, keep working at that. But as you get older, this happens to you, and it's normal. It's the natural way of things, but you just don't want to get to that point, obviously, where you have so little energy that you can't do, obviously, the things you want to do. So anyways, that's the idea behind NAD. Is that contributing for me, let's say, to not having the energy that I had when I was 30 and being able to move furniture all day and still being fine at the end of the day? Whereas now, if I'd move furniture for a few hours, I would be probably pretty beat afterwards. And so there are people who are taking NAD as a supplement now. Typically, a lot of them is done IV therapy, but you can also take it orally. NAD, technically, you have to do as one of their precursors, which are NR and NMN. These are oral precursors that you can take as a pill or as a capsule to increase your NAD levels. Now, my belief with NAD therapy, and I have studied this, and I've actually been on NR capsules in the past, is that it is safe. There's nothing that I can tell that's dangerous about it. So if you want to try NAD therapy, other than, I don't recommend the IV because it's going to scar up your veins if you keep doing it over and over again. But taking that as a pill supplement, you want to try it, go ahead. I think that the danger to NAD therapy, in my opinion, at this moment, is that we don't know if it truly does anything. I took NR and a very well-known brand of it for a couple of months, and I really didn't feel anything. But I'm also, I think, energy-wise, it's not usually an issue for me. I'm not a low-energy person. But there's something, if you want to try it, and especially if you are noticing yourself slowing down with age and you want to prevent that or you want to slow that down, then by all means, if you want to try it, go ahead. I just would recommend taking that oral version, NR or NMN. And I do not have a brand that I'm, recommending. I know I'm not sponsored by any of them because I don't even know if it works technically. But if you want to try it, go ahead. Okay, next question is how to vet a plastic surgeon to know they are good. So how do you know that you're going to get a good plastic surgeon and not some quack, not somebody who's not even a real plastic surgeon? Plastic surgery right now, my friends, is the wild west of medicine. And this is something you need to know, is you have to be so careful, my friends, that you pick the right surgeon for you. And that doesn't mean the surgeon with the most social media followers. Technically, as crazy as this sounds, I have the most around the country in the US, which is insane. But that doesn't mean you should pick me. You should pick me if you do, because you have heard that I do good work, because you like my before and after photos. You know that I'm a real board certified plastic surgeon. So how do you vet an actual plastic surgeon? Okay, it's not by social media followers. Okay, it's not. It is, number one, making sure that they're certified by the American Board of Plastic Surgery. And the American Board of Plastic Surgery only certifies real board certified plastic surgeons. But there's a caveat to that. There's an American Board of Facial Plastic Surgery, okay? And that is a board of ENT or ENT trained surgeons that do extra training in facial plastic surgery. If you're thinking about getting a facelift, eyelids, stuff like that, by all means, I think they're also very equivalent to the American Board of Plastic Surgery, okay? So I wouldn't tell you that you compare me to, let's say, a friend of mine who's a facial plastic surgeon, that I'm any better than them necessarily. No, I mean, we all do different techniques, and they're fully trained to do these facial cosmetic procedures. There's also a board of ophthalmic plastic surgeons, and it's a long, ophthalmic, plastic, and reconstructive surgeons. And that is, I think, a very reasonable group of doctors. They're ophthalmologists who have specialized training in plastic surgery of the eyes and the eyelids. And I think they're very, very good to go, especially if you've got eyelid issues that are really complicated. So if you've got an eye that doesn't open up all the way, or if your eyelids are pulling down and you got a lot of the whites showing, then these ophthalmic plastic surgeons are the subspecialists for eyelids plastic surgery. So I do a lot of eyelid surgery. I do a lot of blepharoplasties, upper and lowers. But if I have a patient who comes in to see me, admittedly, if they have, let's say they come in and their eyelids pulling way down, I know how to treat it, but I don't want to treat it. It's not something that I do regularly. I send them to the ophthalmic plastic surgeons. Now, the problem is there are some facial plastic surgeons who also dabble in, let's say, breast augmentation or in tummy tuck surgery, where they have absolutely zero real training in, but they'll do that. And that's something that I obviously do not endorse and I condemn. Okay, there are ophthalmic plastic surgeons who are doing facelift operations that's outside of the scope of their eyelid surgery. They're ophthalmologists, so they're great with the eyes and eyelids, but I don't recommend that they're necessarily doing facelifts. I think that's outside their scope of practice, and that's not something that they should do. If you're a certified by the American Board of Plastic Surgery, we get training in everything from head to toe plastic surgery wise. So we are technically trained to do all sorts of those types of operations. But at the same time, most of us will end up subspecializing. I subspecialize in cosmetic surgery. And so even though I was fully trained to do cleft lip and palate surgery, you don't want me doing that on your child. Even though I was fully trained in doing hand surgery, you don't want me fixing your tendons anymore. Like, I haven't done that in a long time. And so that's something to keep in mind. So how do you vet a plastic surgeon? The basic thing, number one, is make sure they're certified by the American Board of Plastic Surgery, facial plastic surgery, or ophthalmic plastic surgery, depending on what you want to have done. That's the basic thing. A second thing is you want to make sure that the word of mouth in town is good, and you talk around, you ask people. In general, the people in the hospitals, oftentimes nurses and people who work in the ORs, have an idea of how good some surgeons are, so they can be a good resource for you. You can also, a lot of county courts will show you if a surgeon has had a ton of lawsuits. And if a surgeon has 1 or 2 or even 3 lawsuits, especially over a lengthy career, then that's usually not a red flag, because most plastic surgeons will get sued at some point in their career, oftentimes several times. Now, I've been in practice now over 20 years. I'm on my 21st year of practice, and knock on wood, thank God, I've never been sued before. But that doesn't necessarily mean I'm any better than somebody who's had a couple of lawsuits, because sometimes bad stuff happens. And so that's another thing to do that you can look at. You can look at doctor rating websites. That provides some information, but I'll tell you that that's going to be skewed to people who are unhappy. Because if you have a plastic surgery operation and you're happy with the result, it's a lower percentage of people that are going to go online and give a good review to their surgeon than those people who are unhappy with it. They're pissed. For one reason or another, they may be unrealistic of what their expectations are. They're much more likely to go and bash the doctor than a happy patient is to go and leave a good review. So just keep that in mind there. But those are some suggestions of how to vet a plastic surgeon to know if they're good. And then definitely, look at their socials, see what they put on their social media, see if they connect with you, see if they seem slimy to you, if they don't seem, up on the up and up. I know there's some people who look at my social media and it turns them off. They don't like some of the humor in it, and that's okay. Then you're maybe not my people and I'm not your people, and that's totally fine. You can't make everybody happy. But I do get a lot of patients who see my social media and they like it. And they go, I actually chose you because I like that you seem, authentic and relatable and all of that. And so social media can definitely help as well. Okay, next question is best treatment to get rid of dark beauty spots and prevent them from forming. How do you effectively remove blemishes? So I did actually answer this a bit earlier. IPL is a great treatment. It's an in-office treatment using light energy to basically, you zap those dark spots, they turn darker, and then after 1 to 2 weeks, those spots will actually slough off. That's a great way to do it. That's a way to treat it from the outside in. It's a snapshot where you get rid of those spots, but they can still reform later. And so I do recommend getting on a brightening cream for long-term pigment reduction. We have in my line at Youn Beauty, we've got our Youn Beauty brightening cream. I use that every morning and every night to help with spots on my face. And it's not going to be nearly as effective as IPL. If all you use is a brightening cream like that for spots, it can take 2 to 3 months to start seeing those spots start to lighten and eventually hopefully disappear. But they do work. You just have to be very, very patient. And so ideally, if you've got spots, then my recommendation would be the 1-2 punch of combining IPL with a good brightening cream. And that's how I usually recommend in my practice. Now, how do you prevent them from forming? Once again, the brightening cream can suppress that melanin safely. Our Youn Beauty brightening cream is one to use safe long-term. If you're using hydroquinone, which is prescription strength, then only use that for up to 6 months at a time. Then you want to stop it because there are complications that you can get if you use it for too long. And then really the best way to prevent them from forming is sun protection, sun avoidance and or protection. So not being in the sun all that much. And then if you are putting on sun protection, at least SPF 30. Okay, next question is how to reverse skin aging if I was a cigarette smoker for 10 years. So cigarette smoking is one of the worst things that you can do for your skin. And I tell you, my friends, that I can spot a cigarette smoker the moment they walk into my office. And it's not that you can smell them. I actually don't have a great sense of smell. I lost a lot of my sense of smell many years ago. But it is the skin. The skin looks sallow. It looks dry. It looks flat. You don't have this radiance to the skin that people normally have. And I can spot it very quickly. And there's more wrinkles to the skin as well. And so if you're smoking cigarettes now, please, please, please quit smoking, because that's going to be, not only is it terrible for your health, but it's absolutely terrible for aging and for your skin. And there actually are studies that looked at identical twins, one that smoked and one that didn't smoke, and they followed them through the decades. And as they get older, you can see how the one that smoked eventually looks almost twice the age or the parent of the one that didn't smoke. And this is kind of that 80-20 rule I was telling you about, where 20% is genetics. So 20% of these identical twins, it's all genetics. The other 80% is how they live their life. And you can see just that smoking part of it being such a huge, huge problem with aging as they get older. So if you were a cigarette smoker for 10 years and you quit, and this is your question, then congratulations. I hope you're really proud of yourself. You know, if you're listening today and you're one of our Rejuvenation Nation and you used to smoke and you quit, then I salute you. I commend you for doing that and taking good steps for good health for yourself. You have added many, many years and hopefully healthy years to your life by doing that. But how do you then reverse the aging that you used to have if you were a previous cigarette smoker? The answer to that is what type of aging do you have? And oftentimes it's fine lines and wrinkles is something that you see, in which case I do recommend getting on that 2 minutes, 5 years younger skincare routine. Big component of that is going to be retinol. Retinol is really, really good at helping with fine lines and wrinkles, smoothing the skin, exfoliating the skin. Combine that with exfoliation once or twice a week, depending on the quality of your skin. If you want to add something to that, the vitamin C that's in the 2 minutes, 5 years younger skincare routine is great as well. That's going to help with spots. It's going to help with collagen production, as well as an antioxidant to prevent further skin aging. And so that's what I would recommend in general. If you were a cigarette smoker and you want to know what you can do, just kind of on the surface would be getting on a good skincare regimen. The 2 minutes, 5 years younger skincare regimen is a great place to start. If you've got spot issues, and we have another regimen called the Ultimate Anti-Aging Skincare Regimen that we would recommend that does add a lot more to that as well. But that's where I would start, and then considering other types of treatments as well. IPL if you've got spots. I mentioned earlier microneedling, that's great. A lot of those non-invasive treatments can really, really help. All right, next question is, what's your call on PRP for the under eyes? So PRP stands for platelet-rich plasma, and this is where you basically draw a person's blood, you spin it down and remove the platelets from it, which are chock full of growth factors. You take that platelet-rich plasma, chock full of growth factors, and then you can do different things with it. Now, some people will inject it under the eyes, and they claim that can create some of a filling to it. They claim that can help to rejuvenate the under eye area. I'm not a huge believer in that. I don't think that PRP is a true filler. Some people are using PRF now for the under eyes, platelet-rich fibrin. Platelet-rich fibrin essentially is very similarly done, but you don't spin it quite as fast. And so you remove the fibrin, which has the platelets and stuff in it as well, and the growth factors, but it's a thicker substance. And there are some doctors who say that if you inject that under the eyes, that you can help create that filling effect without a true filler. But to do that, you have to usually do once a month treatments for many months in a row to get even a modest change in that area. And that's a lot, and that is expensive. And to me, it just does not make a lot of sense. I do not believe that PRP to the under eyes does a whole lot. You may get some rejuvenation of the skin to that area, but it's going to be fairly modest. The good news about that, it's just your own tissue. You may get a little bruising from the needle, but other than that, there's probably very little dangers to doing it. It's just probably not going to do a ton. If your under eyes bother you, my recommendation would be to target the treatment to the cause. So if it's puffiness of the under eyes and you're not, let's say, retaining a lot of water by, let's say, a super heavy salt-filled diet or a diet filled with tons of ultra-processed foods, then it could be surgery because it could just be due to protruding fat. If you have got dark circles due to pigment, then the treatment is to use a brightening cream. If you've got dark circles or hollowness, due to that hollowing, then the treatment would be a filler. And I do usually recommend hyaluronic acid-based fillers to that area. Another thing people get is thinning of that skin, and that can cause the skin to look actually transparent. You get darkness from the vessels underneath that are visible. In that case, using a retinol-based eye cream can really help with that. And so for the under eyes, you want to target the treatment to the cause. There is no one perfect treatment for all under eye issues. You got to look at the cause. And if you go back in the podcasts, I did have a podcast, many months ago where I specifically mentioned treatment for the under eyes. And that I think is one that you can really get very specific, actionable information. And let me just see if I can see when that was from, because that I specifically just targeted the eyes. And let's see, I don't want to spend too much time looking for it here. Yeah, I'm not seeing it, but take a peek there. That was a couple of months ago. I'm not finding just offhand as I'm looking it up, but where I go over just the under eyes and what you can do for rejuvenation of the eyes. Okay, so this is a final question, is what is the best treatment for nasolabial folds? Is it laser or surgery? Nasolabial folds are the creases that go between the side of your nose to the corner of your mouth. And these creases are basically caused by adherence of the tissue in that area combined with cheek soft tissues or the cheek fat drooping. And really the only best treatment for that is filler. You could do things like mid-facelifts, which are very, very invasive operations, but the easiest way to treat that is injectable filler. It works very nicely for that. Lasers don't do anything for it. Like I said, you could do invasive surgery, but why do that when you can just inject some filler and that basically fills that area out? So I've got a lot more questions. There's going to be an Ask Me Anything episode 7 coming up in several months. So I'm going to answer more questions in a few months so we can get your questions answered. But I hope this was helpful for you in your journey to really, I think, holistically feel and look your best. As always, if you enjoyed this podcast, if you could leave me a rating or review on iTunes or Spotify, wherever you get your podcasts, we'll do that shout out every week. So hopefully we shout your name out as a thank you for doing that for me. As always, I'm Dr. Anthony Youn. This is the Doctor Youn Show. Thank you so much for watching and listening. And as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.